Now, secondary glaucomas. So, as in the previous lectures, we have discussed all the types and subtypes of primary glaucomas. Okay. Now we will discuss secondary glaucomas. So, what is secondary glaucoma? Secondary glaucoma means when the intraocular pressure elevates, due to any secondary cause. Okay. For example, when there is any pathology in the cornea, iris, lens, etc., it will elevate the IOP. This is called secondary glaucoma. So, on this base of different pathologies of different parts, we have multiple types of secondary glaucomas, and each will be discussed. Okay. So, for example, we have the corneal-related glaucoma, secondary glaucoma. We have the iris-related secondary glaucoma. Okay. We have the lens-related secondary glaucomas. Okay. We have the blood-related. For example, when there is the accumulation of blood, okay, in the interior and posterior chamber, this can induce secondary glaucoma. We can have post-operative secondary glaucomas, okay, or after different operations. For example, after cataract surgery and after glaucoma surgery, okay. We have tumors-related secondary glaucomas. Tumors can also induce secondary glaucoma. We have traumatic secondary glaucoma. Trauma to the eye can also cause secondary glaucoma, okay. And we have the episcleral venous pressure difference secondary glaucoma. Okay, so these are different types of problems with this structure which can induce secondary glaucomas. Now, first we will discuss the corneal and the iris related secondary glaucomas. Okay, so corneal related glaucoma. If you know, guys, from the corneal chapter, in the corneal ulcer, okay, so in the deep keratitis, when there is any problem with the cornea and the inflammation is deep, what will happen? It will release. This deep inflammation of the cornea will release cytokines and toxin. Okay, so inflammatory cytokine and toxin, they will leak into the interior chamber due to the deep keratitis, and it will induce the inflammation of the iris, okay, of the iris and ciliary body. This inflammation is called iridocyclitis, and in turn this inflammatory iris and ciliary body interior uveitis. Iridocyclitis is also called interior uveitis. It will release the inflammatory infiltrate into the interior chamber because of this inflammation, okay. And this inflammatory infiltrate, it can accumulate. It can block the trabecular meshwork, and when this accumulate, this inflammatory infiltrate come and it will accumulate in the pores of trabecular meshwork and will block the trabecular meshwork, okay, and hence it will elevate the intraocular pressure. This is called corneal related secondary glaucoma. Remember, it is an open angle secondary glaucoma. As the angle is open, okay, the interior chamber angle is open, only the trabecular meshwork perforation has been blocked by these inflammatory infiltrates, okay. So this is the corneal related. Now we have the iris related secondary glaucomas. Remember, the iris related secondary glaucomas can also be open angle and closed angle. First we should understand the open angle secondary glaucomas related to the iris. So as in the corneal related glaucomas which induce the iridocyclitis and elevates the IOP. So the iridocyclitis as in the corneal related is the same, okay. So we can have iridocyclitis, okay. It will release the inflammatory infiltrate, and these inflammatory infiltrate will block the trabecular meshwork and hence will elevate the IOP. So the corneal related can also cause iridocyclitis, and iridocyclitis can also be present due to other causes, okay. So this is an open angle secondary glaucoma, okay. Now the second one we have trabeculitis. Okay, so this iridocyclitis and other causes can also cause the inflammation of the trabecular meshwork itself. Okay, So when there is the inflammation of the trabecular meshwork, this is called trabeculitis. And this inflammation of the trabecular meshwork will occlude the perforation because of the inflammation and because of the release of inflammatory infiltrate. Okay, so it will also block these perforation and will induce secondary glaucoma, an open angle secondary glaucoma. Okay, and now the third one, open angle secondary glaucoma, is the pigmentary glaucoma. And it is important, guys. Okay, so pigmentary glaucoma is the deposition of the pigments. Okay, like the inflammatory infiltrate, when there is the deposition of the pigments in the trabecular meshwork, it will occlude the perforations and will induce glaucoma. Okay, etiology, why the pigmentary glaucoma is happening? This is because of a syndrome which is called pigment dispersion syndrome. Okay, so this syndrome, pigment dispersion syndrome, can cause pigmentary glaucoma. What is the pathogenesis of this syndrome? The pathogenesis is simple, guys. What is happening in this syndrome is that these are the zonules. Okay, we know that the zonular fibers, they hold the lens in place. Okay, they hold and keep it in place. So what is happening in this pathology is that there is the bowing of the peripheral iris against the zonules. Means the peripheral iris is bowing. Okay, it bows against the zonules. Okay, this bowing of the peripheral iris against the zonule, it will cause the friction. There will be the friction between this bowing iris and the zonules, and there will be a friction force which will release the melanin pigment granules from the iris. Okay, because of this rubbing and friction, there will be the release of melanin pigment granules, and these granules will be released. Okay, from both sides. These granules will be released and they will come and they will deposit, okay, on the different regions of the interior chamber. Okay, these granules will come and will deposit on the different region of the interior chamber and on the trabecular meshwork, and will occlude the perforation of trabecular meshwork and will elevate the intraocular pressure. Okay, so this is the pathogenesis of pigmentary glaucoma. Now, how the patient will present to us with pigmentary glaucoma? The clinical features, these are, first of all, remember, guys, the pigmentary glaucoma, it is mostly prevalent in young myopic patient. Okay, like me, in young myopic patient. And about 35 to 50% of people, they develop pigmentary glaucoma with this syndrome. Okay, and there will be as the pigment released from these from the iris. Okay, so there will be defects in this peripheral iris. There will be defects. These defects are called radial spoke-like trans-illumination defects. Okay, so we will have radial spoke-like trans-illumination defects. And now we know that the pigment also deposited on different regions. Okay, so these pigments will also deposit on the endothelium of the cornea, and this deposition is in a special pattern. Okay, this deposition is in a spindle shape. Okay, so there will be a spindle shape deposition like this. This is the cornea, for example. If this is the cornea, the pigment will deposit in this spindle shape pattern. This spindle shape pattern deposition of the melanin pigment on the endothelium of the cornea, this is called Krukenberg spindle. Okay. So we will have radial spoke-like trans-illumination defects. We will have Krukenberg spindle, and the patients, these are mostly young myopic patient. Okay. So these are the clinical features of the pigmentary glaucoma. Now, how can we treat the condition? The treatment is similar like the primary open-angle glaucoma. For example, we will give topical anti-glaucoma therapy such as prostaglandins, beta blockers, carbonic anhydrase inhibitors, okay? Plus, if the topical anti-glaucoma therapy fails, then we will induce laser therapy. For example, laser trabeculoplasty, and the most important is the selective laser trabeculoplasty, okay? So we will do SLT, selective laser trabeculoplasty. It will target only the melanin pigment in these perforations of trabecular meshwork and will open the perforations, okay? So after the anti-glaucomic therapy, if it didn't work, we will induce laser therapy, selective laser trabeculoplasty. And ultimately, if this is also not effective, we will induce trabeculectomy, in which we connect the anterior chamber to the subconjunctival space, okay? This is trabeculectomy. So these are some of the treatment options for the pigmentary glaucoma. Okay? Now the close angle will be discussed in the next lecture. So guys, I also have prepared notes. I will give you the link in the description. You can go through the notes and can learn more. Thanks for watching the video.